A stroke is not always a sudden collapse. For millions of people, it announces itself days, even weeks in advance. And 9 out of 10 people who experience that warning never recognize it. Today, that changes.
Meet David, 52 years old. No history of heart problems. Exercises 3 times a week. By every measure, a healthy man. One Tuesday morning, he got a strange headache that lasted about 10 minutes and then disappeared. Later that day, a cup slipped out of his right hand for no clear reason. He figured he was tired. He went to bed. 3 days later, his wife called an ambulance. David was in a stroke unit before the week was out.
Here is what nobody told David, and what nobody is telling you. A stroke rarely comes without warning. In most cases, the brain sends out distress signals through the blood supply. These signals are called TIAs, Transient Ischemic Attacks. They look like nothing. They feel minor, and then they stop. That is exactly why they are so dangerous. Most people take that resolution as good news. It is not. It is the warning light flashing on your dashboard, and then going dark again before you pull over. Before we go any further, this video is for learning only. A stroke is a medical emergency. If any sign on this list appears, even if it goes away, call 911 right away. And write down the exact time the symptom first started. That one detail can change which treatments are available to you. There are 8 warning signs on this list. Some are in the FAST acronym you already know. 3 are almost never talked about. And sign 5, the cognitive sign, is the one most families wave off as tiredness or old age. It is not. By the end of this video, you will know what tests to do at home, what to say to emergency services, and why the phrase, "it went away on its own," may be the most dangerous sentence a family ever says. Picture this. You are sitting at the kitchen table, eating breakfast. Your coffee is warm. The morning is quiet. And then, without any warning, your left hand goes numb. Not the familiar pins and needles feeling you get when you sleep on your arm. This is different. It is a flat, hollow sensation, like someone pulled a thin glove over your hand and part of your arm. You can still move your fingers, but something feels switched off. So, what do? Most people do exactly what feels logical. They shift in their seat. They shake their hand out. They think, "I must have been sitting at a strange angle," or "I probably slept on it wrong last night." They stand up, walk it off, and wait for the feeling to come back. And here is the frightening part. It usually does come back, so they forget about it entirely. But that numbness had nothing to do with your chair. What actually happened is this. The sensory part of your brain, the area that processes touch and feeling, briefly lost its blood supply. Think of it like a power cut to one wing of a large building. The lights go out on that side only. Everything on the other side stays on. That one-sided pattern is the clue. It tells you the problem is not in your hand. It is in your brain. The American Stroke Association lists sudden, one-sided numbness as one of the primary warning signs of a TIA, not a pulled muscle, not poor circulation from sitting too long, a vascular event in the brain. Here is a simple test you can do right now. Press both palms flat against your thighs at the same time. Does one side feel normal and the other feel dull, distant, or different in any way? That difference matters. The fatal mistake is waiting. People tell themselves they will call the doctor in the morning if it happens again. By then, the window for the most effective treatment may already be closing.
The correct response is simple and clear. Call 911. When they answer, say these words: I have sudden, one-sided numbness that began at, and state the exact time. I need a stroke evaluation. That is it. You do not need to be certain. You do not need to wait for a second sign. One call at the right moment can change everything. Imagine you are sitting with your father after dinner. The conversation is easy. Nothing heavy is being discussed. And then, out of nowhere, his eyes fill with tears. Not a slow build, sudden, like a tap being turned on. He is not talking about anything sad. There is no bad news. He looks down at his hands and says, quietly, I don't know why I'm doing this. He seems more confused by his own reaction than you are. Most families read this moment the wrong way. They assume something emotional is going on beneath the surface. An old grief, a buried worry, the weight of getting older. Some think it might be depression setting in. Others feel awkward and change the subject. The moment passes. Nobody calls anyone. But here is what was actually happening in that moment. The part of the brain that controls emotional responses had briefly lost its normal blood flow. Under healthy conditions, your brain has pathways that regulate and filter emotional output. They act like volume controls on your feelings. When those pathways are disrupted, even for a short time, raw emotion can spill out without any trigger and without any warning. The person is not sad. They are not remembering something painful. Their brain is simply producing an emotional signal it cannot control. It is neurological noise, not a feeling. The Cleveland Clinic has documented this kind of sudden emotional lability as a recognized sign in acute cerebrovascular events, meaning events where blood flow to the brain is being interrupted. The question that cuts through the confusion is this one. Has this person ever done this before? Cried or laughed suddenly with no clear reason and seemed genuinely confused by their own reaction? If the answer is no, and it is happening now, that matters. Do not wait for it to happen again. Do not assume it is emotional. Pick up the phone. When you call 911, say this: my father, or mother, or husband, or whoever it is, had a sudden emotional episode. They were crying with no cause, and they were confused by it themselves. It started at, give the exact time. We need a stroke assessment. You do not need a medical degree to make that call. You just need to trust what you saw. You are reading the morning newspaper or scrolling through your phone, and suddenly something is wrong with your vision. Maybe the words go blurry. Maybe part of what you are looking at disappears, like a curtain has been pulled across one side. Maybe you are seeing two of everything for a minute or two. And then, just as suddenly, it clears up. You blink a few times, everything looks normal again. Most people in that moment think the same thing. Too much screen time. A bright light they looked at too long. Or the most common thought of all, I think I finally need to get my eyes checked. They make a mental note to book an optometrist appointment sometime next week. And they move on with their day. But the problem was never in the eye. The eye is just the messenger. The real issue was happening further back, in the visual cortex at the rear of the brain, or along the optic tract that carries signals from the eye to the brain. When blood flow to those areas is interrupted, even briefly, your vision breaks down. The eye itself is perfectly fine. The processing center behind it just went dark for a moment. Here is an important detail worth understanding. If the vision problem happened in one eye only, that points more strongly to a vascular cause.
If both eyes were affected at the same time, that may suggest a problem with the posterior circulation, the blood supply at the back of the brain. Neither situation is harmless. Neither one should be watched and waited on. The CDC includes sudden vision changes in one or both eyes on its official list of stroke warning signs. Not eye strain, not aging, a stroke warning. Here is a simple self-test. Cover your right eye and note what your vision looks like. Then cover your left. Does the problem stay with one eye, no matter which you cover? Or does it shift? Try to remember and describe exactly what the vision looked like and which eye was affected. That information is useful to emergency responders. The correct response is not a call to your optometrist for an appointment next Thursday. It is same-day emergency evaluation. Go that day. If the vision loss is still happening, call 911 immediately. Your eyes may be fine. Your brain may not be. You are standing in your kitchen, perfectly still, not turning your head or making any sudden movement. And out of nowhere, the room shifts. The floor feels unsteady beneath you. You grab the counter to steady yourself. Your balance is gone, just like that, with no warning and no clear reason. After a minute or two, it passes. You feel slightly shaken, but otherwise fine. So what do you tell yourself? Most people run through the usual list. An inner ear problem, low blood pressure from standing up too fast, tiredness, maybe the new shoes with the different sole. It feels like a reasonable explanation, and because the dizziness stopped, it feels even more reasonable to let it go. But there is one question that separates a benign dizzy spell from a serious warning. Here it is. Did the dizziness start when you moved your head, or did it appear out of nowhere while you were completely still? This single question matters enormously. Dizziness that is triggered by head movement is more commonly linked to inner ear issues. Dizziness that arrives on its own, with no movement, no position change, no obvious trigger. That is the pattern that points toward the brain. The reason comes down to blood supply. There is a network of arteries called the vertebrobasilar circulation that feeds the brainstem and the cerebellum, the part of your brain that controls balance and coordination. When blood flow through that network is briefly interrupted, the result is sudden, spontaneous vertigo. The American Stroke Association identifies this as a recognized sign of posterior circulation, TIA. There is also a more alarming version of this sign that almost always gets misreported. It is called a drop attack. The person suddenly falls to the ground with no dizziness beforehand and no loss of consciousness. They are fully awake. They simply could not hold themselves up for a moment. Families almost always describe these as trips or slips. They are frequently neither. The correct response is straightforward. Spontaneous dizziness, the kind that arrives without any trigger, combined with any other sign on this list, means one thing: call 911. Do not let anyone talk you into starting with an ear specialist or waiting for a vestibular assessment. That delay has cost people the treatment window they needed. Get stroke imaging first. Everything else can follow. Your mother is sitting at the dining table, relaxed, nothing unusual about her appearance. She asks what time dinner will be ready. You tell her, 6 o'clock. She nods. 2 minutes later, she asks again. Same question, same calm tone, as if she never asked the first time. You answer again. Another 2 minutes pass. She asks a third time. When you gently point out that she has already asked, she looks at you with genuine surprise. She has no memory of asking at all. This is the sign that families miss more than any other on this list, and the reasons are completely understandable. First, the person experiencing it has absolutely no memory of the episode once it passes. They feel fine. They will tell you they feel fine. Second, families almost always find a comfortable explanation. She did not sleep well. The medication makes her foggy sometimes. She has a lot on her mind. Third, and most dangerously, when the episode ends and she seems completely normal again, it feels like relief. It feels like confirmation that nothing serious happened. That feeling is wrong. Neurology literature has documented a clear link between this pattern, called transient global amnesia, and TIA. The sudden onset, the repetitive questioning, the defined window of time, and the complete memory gap afterward are not signs of tiredness. They are signs of disrupted blood flow to the memory centers of the brain. Run through these 4 points. Did it come on suddenly, with no gradual build? Was she asking the same question repeatedly, without retaining the answer? Did the episode last a defined amount of time and then stop? Does she have no memory of it now? If the answer to all 4 is yes, this is an emergency. One more thing that must be said clearly. Women are significantly more likely to experience atypical stroke symptoms, like this one, cognitive and behavioral changes, rather than the classic physical signs. And emergency triage systems are less likely to catch them. So when you call, be direct and specific. Do not let the presentation be softened or explained away. Say this: my mother, or whoever it is, had a sudden confusion episode. She was asking the same question repeatedly and has no memory of it. It lasted approximately, give the time. I need a stroke assessment. Say those words exactly. You reach for your morning coffee and the cup slips from your right hand. You try to open a jar and your grip just will not work the way it should. Or you catch yourself in the mirror and notice that when you smile, only one side of your face moves. The other side stays flat, like it did not get the message. The most common reaction to moments like these is to brush them off. You tell yourself you are clumsy this morning. You switch the jar to your other hand and moved on. And because the weakness was mild, not a dramatic collapse, not a paralyzed arm hanging limp at your side, it did not feel like something worth reporting. This is one of the most dangerous myths surrounding stroke. The weakness does not have to be severe to be significant. Mild, sudden, one-sided weakness is still the alarm going off. Here is what is happening in the body during that moment. The motor cortex, the part of your brain that sends movement signals down through your body, has lost blood flow in a specific region fed by the middle cerebral artery. The signals going down to one side of your body are being interrupted. The result is weakness on that one side only, not both hands, not general fatigue, one side. There are 2 simple tests you can do right now with another person. First, have them extend both arms straight out in front of them, palms facing up, and close their eyes for 10 seconds. Watch carefully. Does one arm drift downward while the other stays level? That drift is the sign. Second, ask them to smile fully and raise both eyebrows at the same time. Does one side of the face move less than the other? That asymmetry matters. Here is the detail that separates a stroke warning from an old shoulder injury or chronic joint pain. Vascular weakness arrives in minutes and can resolve just as quickly. Weakness from a muscle or joint problem builds up slowly over days and weeks. Sudden onset and quick resolution is the vascular time course.
It does not make the event less serious. It makes it more urgent.
The American Stroke Association is clear on this. One-sided weakness is a primary stroke and TIA indicator. The correct response is not to add up symptoms and decide if you have enough to make the call. Any one-sided weakness combined with any other sign on this list, call 911 immediately.
You are mid-conversation with someone you love, and something shifts. They stop speaking and stare at you, clearly knowing what they want to say, but completely unable to get the words out. Or the opposite happens. They keep talking. The sentences sound normal in rhythm and length, but the words are wrong, mixed up, nonsense, and they do not seem to notice. You try to respond and realize they cannot understand you either. There are two distinct types of speech disruption to know about. The first is expressive. The person knows exactly what they want to communicate, but the words will not come out. They may look frightened, frustrated, or frozen.
The second is receptive. The person is speaking in full, flowing sentences, but producing the wrong words entirely, and they cannot make sense of what you are saying back to them. Both types are serious. Both types are emergencies. But here is the sentence that appears over and over again in stroke unit admission notes across the country. It only lasted a few minutes, and then it was fine. We figured it was nothing. Families wait. They watch. The speech comes back. And because it comes back, they feel relieved enough to go to bed, or finish dinner, or decide to call the doctor in the morning. That decision has consequences that cannot always be undone. Think of it this way. If your smoke alarm goes off for 4 minutes and then goes silent, you do not roll over and go back to sleep, assuming it was a glitch. The alarm went off for a reason. You find out why. A speech episode that resolves on its own is that alarm. The fact that it stopped does not mean the danger passed. It means you are inside the window where treatment is still most effective. The CDC and the American Stroke Association both identify speech disruption as one of the most time-sensitive warning signs of a TIA. It is also worth knowing that speech problems originating in the left hemisphere of the brain very commonly travel with right-sided weakness and right facial drooping. These signs tend to appear together. If you notice more than one of them, that pattern is significant. When you call 911, use these words. My family member had a speech episode. They could not produce words, or they were speaking but making no sense. It lasted approximately. State the time, and then resolved. I believe this was a TIA. I need emergency evaluation. Say it clearly. Say it confidently. You are not overreacting. You are acting exactly on time. You or someone near you suddenly grabs their head. The pain is immediate and intense. Not a headache that has been building since morning. Not the dull pressure of a stressful day. This one arrived in seconds and went straight to its worst point. If the person can speak, they may say something they have never said before about a headache. That it is the worst pain they have ever felt in their life. There may also be stiffness in the neck, not the kind that comes from sleeping at an awkward angle, but a tightness that makes it difficult or painful to move. The natural response is to reach for a painkiller, find a dark room, and assume it is a tension headache or dehydration or too much stress. These are the explanations most people land on because they are the most familiar. But there is one feature of this headache that separates it from every headache that has come before, and it is the most important detail in this entire video. It is called a thunderclap onset. The headache does not build over an hour or worsen gradually through the day. It explodes to full maximum intensity within 60 seconds of starting. That single characteristic, the speed of arrival, is the defining warning sign. A headache that reaches its worst point that fast is not a tension headache. It is a medical emergency until proven otherwise. What is happening in the body during this moment is this. Blood is leaking into the space between the brain and the thin membrane that surrounds it. This is called a subarachnoid hemorrhage, and it is the hemorrhagic pathway of stroke, meaning it is caused by bleeding rather than a blocked artery. Every single minute from this point forward matters in a way that is difficult to overstate. Here is the self-test. Ask the person to slowly bring their chin down toward their chest. If that movement causes pain or significant resistance, if the neck fights against it, that is a sign of meningeal irritation, meaning the leaking blood is already causing inflammation around the brain. This is not a pulled muscle. The Cleveland Clinic and emergency neurology specialists are unambiguous on this. Do not rub the neck. Do not lie down and wait for the pain to ease. Call 911 immediately and say these words: sudden severe headache, thunderclap onset with neck stiffness, possible subarachnoid hemorrhage. We need emergency imaging right away. You have now been through all 8 signs. Take a moment to consider how many of them you did not know before pressing play on this video. That gap in knowledge is not your fault. It is a gap in the way stroke awareness has been taught to the public for decades. Most people have heard of FAST: face, arms, speech, time. It is a useful starting point. But FAST covers only 3 of the 8 signs on this list. The numbness, the emotional episode, the vision change, the sudden dizziness, and the cognitive sign. All 5 of those fall completely outside the FAST acronym. A person can experience a TIA, recover fully within the hour, and show no FAST signs at all. They can seem completely fine to everyone around them, including themselves. And without the full picture, everyone in that room will let it go. Knowing all 8 is what closes that gap. There is one idea from this video that is worth carrying with you from this point forward. Resolution is not reassurance. When a symptom disappears on its own, it does not mean the danger has passed. It means you have just witnessed the definition of a TIA, a warning event that resolves but leaves the door open to something far more serious if it is not treated in time. The disappearance of the symptom is not the end of the story. It is the beginning of the window where action matters most. Here is the number that puts everything into focus. Treatment within 24 hours of a TIA reduces the risk of a subsequent full stroke by up to 80%. That is not a small margin. That 80% is not reserved for people with medical training or fast reflexes. It belongs to anyone who recognizes the signs, makes the call, and does not wait for the symptom to come back. It belongs to you and to the people you love. The next video on this channel covers the 6 daily habits that trigger a stroke. It is on screen right now, and it is worth watching immediately. If this video gave you something useful, subscribe and turn on notifications. This channel exists to give you the information your doctor does not have time to cover in a standard appointment. And one last thing. Share this with one person in your life who is over 55 or who has a parent over 55. You do not need to say anything when you send it. Just send it. One share. That is all it takes.